everybody. Welcome to today's work session on the budget. Sadia?
Yes, absolutely. Good afternoon. Welcome to budget session number 2 as part of the fiscal year 25 proposed operating and capital budget. I'm Sadia Satara from Budget and Management Services. Before we kick off, just a quick reminder that all of our budget documents are listed up on our budget.raleighNC.gov website. So that's something that we wanted to share. But what we really are here for today is based on, some feedback or a response that was needed by Councilmember Harrison to talk about that fourth piece of the alternative response pilot that we are piloting as part of this year's budget as well. So without further ado, I'll hand it over to Michelle Mallette to talk about this a little bit further. Thank you.
Good afternoon, everyone. Thank you, Sadia. So we have been before you a few times, so I'm going to make this quick and get straight to your questions if I can. But I do want to go through at least a few of the things we've discussed previously just to kind of set the tone for this afternoon. So as part of the budget on May 21st, we made a formal request to you all for the following things. So as part of the Raleigh alternative response model in the city of Raleigh specifically, we've agreed to 4 of the common components. And as part of this year's budget proposal for FY25, we asked for an allocation of $800,000 as part of our co-response team, $380,000 for the pilot of a crisis call diversion line, and $205,000 for our care navigation and case management. As you notice in the question that was asked by Councilmember Harrison for some follow-up, there's no direct funding allocation at this point being asked for the community response team. So let's break down those budget asks. And I have in the audience with me, I do apologize, each department head that is responsible for each of these components. So if you have additional questions for them, they are available. So our co-response, which is currently housed in the Raleigh Police Department and is affectionately known as ACORNS, is an $800,000 ask. That ask is for a one-time funding replacement of $800,000 that was given to them by ARPA. This replacement is to address a few things: a client tracking software, a dashboard build-out, a continued cost of a non-sworn vehicle, and also a mobile office. If you all recall, this office was brought up with not many resources. They were kind of shuffled around based on the resources that the Raleigh Police Department had at the beginning of its program, and then it was given the $800,000 out of an ARPA allocation in order to expand the program and also work on a few projects. So this replacement is not to give any more officers to the ACORNS program, but actually to enhance and also deal with some of the questions around accountability. And also, like I said, build out this dashboard in order to make sure we have transparency in the program. The crisis call diversion line, which we are calling a pilot, but it doesn't go away. We say it's a pilot because we have different types of implementations that we're going to work through over the next 18 months. And then we hope to expand it beyond the ask that covers 3 contracted licensed clinicians that will be directly placed in our emergency call center. The calls will be covered from 9 a.m. to 5 p.m., 5 days a week. And also training across all the ECC staff in order to be adequately prepared for these types of calls and know when they need to be transitioned to the CCD line. The third ask that's related to money at this point is our care, navigation, and case management. And this will be housed in our Housing and Neighborhoods Department. And this will have a team of 3 peer support specialists that would go directly out after being referred or sometimes directly contacted in order to connect people to resources. We feel that this is really important to place in housing and neighborhoods as they are already connected directly to the resources. And we really want to make sure we look at this program holistically and connect people to the direct services that they need beyond housing. And I know some people have asked that question, why is it in housing and neighborhoods? Because they already partner with different types of organizations that provide wraparound services, not just housing. So we feel that they can build upon the already asked before you as part of the budget from Housing and Neighborhoods Director around her Houseless Task Force. So again, the 4 components, just a reminder here, what they are, and the fact that a community response team right now is not being asked for a funding allocation. However, what are the components of our entire program? I think it's worth kind of mentioning some of the things that are common in an alternative response and who currently is the provider, and then what are our next steps as part of the budget to kind of walk you through. So direct dispatch. Currently, when we say direct dispatch, who actually goes to a call that is received from ECC? Currently, the police department, the fire department, and Wake County EMS. What are we proposing to you for FY25 is to actually add those social workers. So you will have that co-response direct dispatch there. Dispatch for referrals currently are just acorns, but with this budget, the peer support specialists will be added to that. And so they will definitely come after hearing from our partners as well as other city departments that there may be a challenge there and try to resource them. Transport. As we know, with the common part of the components of a community response team for people being transported, what does that look like currently? Wake County EMS does that. And what for FY25, it's in progress for us. That's why we want to come back to you all after we have an implementation of what it could look like. On-site care, directly being provided through EMTs. Wake County right now provides that service, and some limited amount from the Raleigh Fire Department operating under the medical license at the county's level. And that's in progress for FY25. Like I said, we want to come back to you all for a formal implementation there. And continued care. This is really important. We talk a lot about what happens at the scene itself in the call, but it's beyond the call itself. It's what happens afterwards. And so facilities themselves are needed, and we don't currently do that either. And so Wake County Health and Human Services does, as well as our area hospitals. And we know they're starting to bring some things online. For example, Wake Brook, I think a few of you attended that, as well as Wake Med's opportunities right now to expand into the mental health realm, specifically with some brand new facilities coming online, which is another reason why we want to have that community response team have somewhere for individuals to go to get continued care. Case management is, again, beyond that incident or the initiating call. And currently, Acorns does some limited amount of it, as well as Wake County. But we hope by bringing on those peer support specialists in this fiscal year, they will also track and do that own case management as well. Having that software being kicked off next fiscal year, obviously being housed directly at first with the Acorns unit, but then we'll add on the other pieces of our program to also start to use that software and keep the program accountable, as well as that case management so people can follow through. So what's needed, in particular around the community response? A promise to you is we'll have staff dedicated to working with Wake County and additional partners to do what? To design a system for direct dispatch, direct referrals, transport, on-site care, as well as that continued care. Dispatch from 911 calls, in particular the nonviolent behavior calls, as far as also quality of life calls for service, which currently are only done right now by the police department. And then develop the official protocols for how we'll address those lower risks. To council members' Fort questions back in, April, about what are those additional partners outside of Wake County and Raleigh Police Department, but the sheriff's office and different people like that. So we can have those protocols that even if it's not dispatched to someone who is not law enforcement, but what will law enforcement do? And so that continued process of those lower risk protocols from everybody within the system that will answer calls within Raleigh. So next steps. Again, we want to continue those partnerships. This doesn't just happen to go away at this moment when we're asking you for the budget allocation. We're going to continue to go back to the Raleigh Hearts Coalition, who did a lot of work in the community. We're also going to work again with those wraparound services providers, Wake Med, Alliance, Allied, people that provide health and human services and have this as part of their charter, Wake County, NAMI, the state of North Carolina. And again, that peer support, which is really important, who will help with our own peer support specialists kind of develop those programs who are working directly in those centers and directly with people day in, day out. So what are those next steps? You all asked, when will you see me again? I think one of my favorite songs from Babyface. I will be back again before you in September, October timeframe to actually ask you to authorize that contract that you've already would have agreed for with passing the budget with that CCD line. as well as that care navigation program components to make sure after we've done that work with the community to make sure we designed a program that you all feel comfortable with, we'll come back to you guys. We'll work directly with the Community Engagement Office in order to design a communication and education of those new programs. As we know, when you hire people, the work just doesn't start that day. You want to make sure you have training. Like I said, with the CCD line, we'll make sure the 911 operators and anyone else that will be taking direct calls will understand what the CCD line looks like. And these are all estimates. I hope that we beat those. I'm always live with the kind of, at least my father used to say, under promise, over deliver. So I'll be back before this time, but I think, we have screenshotable moments. So I want to make sure you keep me honest. So with the care navigation, obviously having staff get on board, getting them trained, aligning them with that homelessness or houseless task force that's going to operate under the Housing and Neighborhoods Department. Hope to launch those way before January, but just giving us a little clearance there. And then the community response update. As I talked about some of those components that the county and other partners already provide, want to work with them to, like I said, implement those different things and make sure we come to you with a formal program and a formal ask. It may even be an off, quote unquote, budget cycle ask when we get to that point. So I'm going to step away from the podium. As I said before, we have staff available who manage all of those programs or who will manage all those programs once you pass the budget. But I want to make sure you have the opportunity to ask those questions.
Okay, Councilmember Harrison.
Yeah, thank you so much, Michelle, for the presentation and just providing these updates. As you know, this is really important, I think, to council and moving this forward as far as we can go, as fast as we can, but also doing it well. So, I really appreciate the work you put into this. I have a few different questions and comments. My first one, and I think you mentioned it towards the end, is about, continued partnerships with community. I really applaud Taisha's team and all the community engagement efforts. They were huge. They mean a lot to the community, and I know the community wants to stay involved as a partner, as a leader. And so I'm curious, do we have an identified community team, implementation team, or task force, or how will those conversations continue with the community? What will be our structure moving forward?
So we don't have an identified task force. What we can is take that assignment and start to identify. What we've decided to do, at least for, I'd say, the first launch, is check in periodically with those same partners to say, here's where we are. This is the things that we've done. This is who we've met with. As far as the CCD line and the care navigation, definitely, I think a task, quote unquote, force would be helpful as we design the programs itself and the components, and they could definitely be instrumental. But I don't want to lie to you and say we have a timeline or identified task force, but we can definitely work on that. I know Councilmember Black had asked us to work with specific groups in the beginning, and so we can continue those groups and expand it beyond as well.
Yeah, I'd appreciate that. I think that's critical to keep that trust and build on that. Another question I have is with the housing and neighborhood peer support specialists. My understanding is they're going to meet residents in need where they are with a referral. So it could be at their homes, it could be on the street. How will we determine whether that needs to be expanded? How will we be able to identify if we are meeting the needs, or we need perhaps more of those types of specialists?
I'm going to look at Emma, and hopefully she'll get the eye to start moving towards me, and so I'll talk until she moves over here. But I think what's the best way to answer that is, obviously, again, coming back to you in that fall of October, saying we've got the staff on, here's our implementation plan. But I'll let her speak directly to what that looks like.
Right.
Yeah, I got the eye. I think we're going to, it's an iterative thing, right? I think we're going to learn and respond as needed, and we'll bring back to you the information about what we're seeing and what we're finding and what the needs may be, and go from there. If that.
I guess, will you be bringing back like data and specific metrics, or like how are you going to track? Is that what you're asking?
Yeah, absolutely. I mean, I think, and Michelle, you referred to the database.
So once that database is set up through the Acorns first, we're going to expand it through all the units, and so you'll be able to see all the components of the program on the web as we pull out reports, and so that's why it's going to be critical at that launch for people to really understand what are the performance measures and what we're tracking. But before that, that's why it's going to be important, to your point, to kind of identify those community members or task force to help us build what's important to them and what they want to hear as we report out. But everyone will be using the software. The goal right now, again, that's why I say that replacement dollars, we're already starting to work towards implementing that now, but that's just kind of replacing that for what it is and getting it started with a unit that's already funded.
And do you have an expectation for when that public data dashboard will be available? And apologies if I missed it in the slide there.
No, it's fine. It was not specifically spelled out. So again, I'm going to under promise and over deliver, but again, if we could get it done, I think before the fall, you'll see it before then. But we've already started to work through what are some of the, I would say, most common tracking performance measures, different things. Obviously, we've seen different dashboards across the country and what are some of those important things that their community has said. But we're going to come back to our community to make sure we're tracking the things that are important to them and obviously protecting the individuals and clients that we interface with.
Yeah, I also appreciate that you put out there some of the needs we have with the county. You know, our Raleigh residents are also residents of Wake County, and so I'm really looking forward to, seeing the role that the county can play. I've been in touch with some county commissioners on that front. I know that you all have been talking to staff at the county, and we really need them as a partner to, grow this program. And so I'm shouting it to anyone who will hear right now, the mountaintops.
We'll raise the roof with you.
Yes, because otherwise I don't see how we can get, some of the pieces at the end done for the community response teams. And that's the piece that I think the community right now is like, where is that at?
I just wanted to add that we also will be accessing HMIS, Homelessness Management Information System database. So I think that too is going to be informative as to exactly who is experiencing homelessness out of the group that the peer support specialists see. So I think we can also pick apart kind of and really look at what is going on with the people that are being served.
That's great. I think all I have to say is that at the end here, so much of us, we support this, 150, 200%. Thank you for this work. Let's continue the work. And I know there's probably other questions and thoughts here. Just want to say, let's keep this going and get it to the finish line. So thank you.
Okay, Councilmember Patton, then Councilmember Black.
Yeah, thanks for this. I just want to reiterate or confirm I heard you correctly that this dashboarding and tracking software is going to be rolled up under the Acorns budget, but that all components of the program will use it.
Want to use the microphone? Yes.
Awesome. Excellent. I know that some of the community concern we've heard is that this is built out proportionally, that there would be, they are concerned there will be a risk of opportunities to point to and say, well, there weren't a lot of calls to the CCD, so we should collapse it instead of expand it, knowing that the hours are limited. So I think it's important to hear that it's going to be in all of those places, and I'll just kind of flag for us as we continue to reflect. I don't believe that's the intention of anyone here, but that we not allow the data to be limiting in that way.
No, and I just want to say, if you recall from that April conversation that Jacob, our assistant director, referred to kind of his history with starting the CCD line, as well as where we looked at other programs, there is no real kind of, I would say, perfect solution for timeframes for a CCD line. So we're just starting with those hours. But again, we use the word pilot only because the hours and as far as the kind of guardrails around the program are a pilot, but it doesn't go away. And so to your point, when the tracking, whether the numbers say we only get 5 or 6 calls, if that's 5 or 6 calls that are diverted and actually receive resources, that's a win in our book. So it doesn't go away.
Yeah, awesome. That's what I want to hear. And I think that's what the community wants to hear. I think we're all running in the same direction. Certainly, I understand there's four components of this program. There's 3 that we're getting off the ground, but the one that's the most important to the community is harder to build and farther afield, and I know that's frustrating to them. I really appreciate this timeline of when you'll be back in front of us. I know it'll allow us to keep ourselves honest, but also give the community some benchmarks to hold us accountable to. In specific,
with reference to the fall, I just want to throw out that I think we'll face our capital reserves, the sales tax, and closing of the books around that time. And so I would flag for consideration of my colleagues that we make this our top priority from budget surplus. Hopefully by that time we'll have a little bit more of understanding of what we need to fund and how. And so I would make that the top priority for our budget surplus at that time.
Okay, Councilmember Black.
Hi, Michelle. Good afternoon. I just want to start by saying I really appreciate all of the work that has gone into really being thoughtful about building out this alternative response program over the last year and a half when we were really able to start making motion on it. I know it's been a conversation that's been happening across council for a couple of years now, and this has just really been the time to start to pull it together, specifically under our co-response model, our crisis call diversion, our care and navigation case management. I think, we're really ebbing and flowing and moving in the direction of where we wanted to go. So this is going to be mostly questions that are bringing up and addressing some of the things that I've been hearing specifically around the community response team, which is what everybody has been really upset about. So one of the questions that I hear a lot about is how Durham was able to do it, and they were able to do it in this way very quickly with all of the work that went into it. So I was wondering if you could speak, and maybe you can't, but speak to some of the differences between why that was able to happen in such a quick way with Durham, and what is the difference between Durham versus Raleigh within Wake County, and just some of the conversations there around being able to build out a community response program.
Yep. So I think it's a little complex, and I will lean to the manager just for a couple of conversations, but I think the quick response for Durham's kind of large investment, which isn't popular, I think, across municipalities, so I'm probably going to get in trouble with all of my department heads mostly in here, but they made a decision to pull all of their vacancies for their entire organization into one bucket. And so by pulling all the vacancies across your entire organization, you have a surplus of positions and a bunch of resources that you can pull on immediately if you choose to do that at a operational level. So that's what was kind of a pull, I would say, a huge resource push in the beginning. The other piece is Durham County itself only serves Durham. And so where their resources around dispatch, transport, and they made the decision as well to do it collectively. And so that was a really huge, I think, push for them, and also an advantage that we don't necessarily have as we don't do transport and provide those services. I also think, I know that Durham's quote unquote start date feels that way, but they started conversations before their launch, as well as community conversations, as well as the community push that we all have and we love, and the engagement there. And so I know their start date feels like, oh, they turned it on with a light switch, but it didn't happen that quick. And we know that from our other partners as well, that it doesn't happen that fast. So I think when they made that decision, that's when that switch turned on for the rest of the community to hear a little bit more about it. But I mean, they did over a year of engagement with their partners too before actually launching the program too. So as far as the community response, I think there are conversations in Durham and other municipalities about kind of that co-response is better, actually. I will not speak for other municipalities. I don't think that's fair. But in our conversations that we have, we hear more so that the co-response is really the initiation that you should make first with community members, and all different types of organizations respond better as well. So I think that we're doing the right thing by going in this pace, in this path. But I can understand the community's frustration as well. If I fill out a survey and ask for something, that's what I want, right? And that's why I took the time in order to communicate in that way. But I think it's important for us to look at, okay, what are some of the things that we know we can do ourselves as far as our charter? What are the things that we're responsible for? Where's our lower risk? Where are the ones and the gains in the community that we can have? Because ultimately, if we have peer support specialists and a CCD line, hopefully we'll reduce the amount of people that really need services in the first place. And then also by implementing programs slowly and I won't say accurately, but good and effective, the community trusts you a little more to come to you before you get to a point where you're in dire straits as well. And so I don't know if the manager wants to add any more about what Durham had, but I don't know if it's fair to also speak on their entire budget process.
No, I would say just from an operational lens, the easier part for Durham is much like what we saw in Denver. It's almost like a consolidated government. Durham has Durham City. There are 12 municipalities in Wake County. And so when Wake County is in their decision-making process, it's not just Raleigh. We try to stay at the forefront, obviously. Had a conversation with the county manager on Thursday, and they are willing to continue conversations. I think that is a step in the right direction, much further than we were 4 months ago. So I do think there is an appetite to kind of see how this works. So I think what really worked in Durham's benefit, to Durham's benefit as well as to Denver's, is there is that consolidation of services, and it is clear a delineation between city and county pretty much across North Carolina, and specifically in Wake County when there are 12 municipalities.
I will just add, Charlotte has the co-response model as well as the CCD line, and they are moving towards they're moving towards that community response when they have, because now they have that formal partnership with their county, with Mecklenburg County, and they're seeing some success there too. So hopefully that answers.
Thank you for speaking to that. I think those are many of the things that I understood, but I wanted to have it be more transparent because it's a conversation that continues to pop up. I do think the aspect of talking about pulling vacancies maybe is a more radical idea than what Raleigh city governance is ready for. But I know also people have mentioned that. So I don't know if there's an appetite for potentially in the future as things flow of creating positions within the city to kind of do these things, to kind of look at these issues while building out those relationships as possible. But I think that's something that I've heard reflected in the community, and I wanted to share that at the table. So one of the things I also heard mentioned in the last conversation was aspects of trust. And one thing that I have heard from many of the community groups that were actually a part of the initial task force or the community group that was holding a lot of the communications work and the community engagement work for doing the alternative response program, they're feeling like there's a strong lack of trust, and that if this process takes place the way it's happening and how it's going, that there's just going to be, it's going to be ineffective and people aren't going to care about it. So I'm hoping that we can speak to trust, maybe not right now at the table, but during the process of how we're really going to strengthen those relationships, because I don't know where we are with trust when the groups that we were supposed to be working with to do the community engagement are saying that they are lacking trust in the process and in trust in the city. It's a little bit concerning for me because those are the groups that we were doing all the work through. So with that being said, and speaking to some of the relationships that we are building with the county level, and I do think, like you mentioned, is really imperative for building out an effective program. Can we speak to some of the where we are in those conversations with the county? Is it possible to speak?
Yeah, so I can easily speak to, we don't have a bad relationship, so I just want to dispel that. So there's no bad relationship. I think what you're referring to is us saying, hey, we need you, county. And that's more so saying we need the partnership in a way that makes sense for them as well as us. And so it's not it's bad blood. So let's clear that up. No Taylor Swift references here. But I think the challenge that we're facing is, so they have, a task and a list and things and priorities, right, that have been put before them. And we have a task and a list and priorities and things that have been put before us. And so I think they're more in alignment now. And so the quote unquote continued conversations that the manager referenced, I think are bigger than conversations. I would love to say they're working groups, as we are really talking about what are the data collection points that they would need, what is the type of pilot that we could see that could work over our landscape in the city itself. To the manager's point, we are the only municipality right now asking the county for it, and so they've got to balance those priorities as well. We have different planned engagement or speaking engagements and all different types of opportunities with them already booked and calendared to continue the conversation. So I'm really encouraged about this component coming online. Again, I just want to dispel there's no bad blood. but
No, I mean, it's
definitely
not-
the relationship.
We haven't been
has
hearing
been
that
there.
there's bad blood. We've been hearing that there's like no conversations that are really happening.
Oh, no, they're happening.
I believe you. I just wanted like you to like speak to that more. Because I believe you, but it's just I think a lot of people feel like nothing has happened in the last year and having these conversations and nothing has been yielded as far as building the relationships out. And so they're just curious to where we are, like where we're going and like how long it's going to take to get there with some of these partnerships as we're building out specifically the community response team.
I think it's fair to ask about the LIMP, but as far as relationships, I don't hate to, again, keep putting my colleagues on blast, but I mean, the fire chief as well as the ECC director work with the county, in particular, the partners that would do this type of work every single day. So the conversations are there and the foundation, it's just laying out what would be implementation, again, for like I said, Raleigh. As we know, ECC takes calls across the county, and so narrowing down the focus of the data, what do they necessarily need us to kind of pull out, to your point,
Have you
that
guys
dashboard
gotten
would
that
really
from
help.
them, like what we would need to try.
We're working through, what those would be, but
So the other question that we've been hearing a lot about is the planning and the benchmarking for everything. And I think you spoke to that when you talked about the database earlier. Yes. So who's gonna manage like all of that across the whole thing? Because it's housed in 3 different departments.
Mm-hmm.
So who's really over managing that database?
currently myself. But no, we will have a dedicated resource to kind of help pull all those things. But to your point about the data collection, one thing that is clear to us, again, in having those conversations and those really good work groups is because the police department is the first group that kind of comes out and takes those calls. They do a really good job with data collection, collecting those points. And so them getting the software first, us building it out, using national standards and different programs, I know communication's gonna get me for turning around, but using those national standards and different programs in other cities to know the data points that they collect, then we can start to pull those things into, and then again, to that larger conversation to the county about kind of what they need in order to kind of see the landscape of the city, we can also pull those data points as well.
Okay, and this is my final point. So back to the conversation around trust, one of the things that I think would help with really reestablishing trust, just so people believe that this program is happening and the city is taking it seriously and we're not trying to undercut any of the things, the very real things that they shared, because that's really what I've been hearing. Like people came and they cried at these meetings and it feels like the city's like, whatever, like we're gonna do what we wanna do. And so just within the aspect of benchmarking and like managing all the information and like not necessarily building out the relationship. When I speak about relationships with the county, I mean, county, are you going to be doing the things that we need you to do? And how can we do the things that you need us to do to make this happen? Like really managing that outside of yourself, because you've been doing a good job for the last year, but somebody that's just over this. I think it would be interesting to possibly look at a staff position. And I don't know I don't think it would be in this budget, probably not, but like in the future, something that could really speak to the work that is happening and someone that's over like all of the benchmarking that happens across these 3 departments and like
Who brings it all together, right? Yeah, make sure the
to make
data
it,
is consistent.
like very clear that this is something that we see and we value and we have people working, rather than like all of these moving pieces all across like what is the city.
Yeah.
So those are my thoughts. Thank you again for all of the work and for coming back to be so transparent.
No, you're welcome. And I think, again, part of trust, just so I can pick it up just a little bit, the communication between our partners, I think, is also a big part of that trust too, right? So our partners feeling good about the decisions that we made and the recommendations that we have, because they'll also be, right, part of your selling points of your program. And so when they feel like, okay, we're servicing individuals because you connected us to direct services, I think that will also help too.
Councilmember Jones?
I'll echo the thank yous. I do appreciate it. I just want to stay with the community groups for a second and the survey that was done. I think what we heard loud and clear from the groups was that I think the 92% of survey respondents that wanted the co-response unit, that's where the frustration lies. So I'm interested in hearing more about the conversations that led up, to now between the groups to kind of clarify, was the co-response unit always the last piece that was going to be last funded? Do they understand that? When we realized it, how did those conversations go? They seemed very taken aback, and I'm just wanting to learn more about that process.
I think the community engagement manager is probably the best person to ask that question, but I'll fill
Thank
it in.
you.
Hello, Taisha Mosley with the Office of Community Engagement, and I'm actually going to co-answer this with Michelle. So it's okay. Taking a step back, so you're right. The survey said that 92% of the survey participants favored establishing a community response team. In addition to that online survey, it did have 1,400 participants. We had over 45 hours of engagement, over 22 public events. And so the conversations varied. But one of the consistent pieces was, as you said, the community response team. And so when we were conducting the engagement, we never gave a plan as to which part would happen first, second, third, or fourth. It was a matter of, here's the overall vision. Tell us what your preferences are as far as, like the survey, for example, had questions about, in this type of scenario, who would you like to respond? What type of characteristics would you like them to have? So I think it's fair to say that we, like I said, we did not give them kind of a plan for, because the plan didn't exist at that time. It was just very raw. I think Councilmember Black said it, conversations, people crying, being emotional, and telling us their experiences. And what we promised to the public, again, is that we would consult them, we would involve them in the process, and that we would bring their feedback to the decision makers. And so that would be my answer to that.
Thank you.
Do we have any other questions? Councilmember Branch?
First of all, thank you for the information, just giving a big overview of how do we got here. One of my questions is, I go back, and like you said, it's a time and stamp, tweetable thing, but it says from 9 to 5 are the hours that they'll be working the ECC. I just want to just highlight, just make sure we really look at our data and things of that nature that we may have of when we tend to get maybe calls of distress and trouble, and be willing. I know I'm kind of saying this for the public, but making sure that we're flexible on those hours, because 9 times out of 10 things I'm hearing, non-scientific, early Monday mornings, typically I've heard where there's been a lot of issues of calls, but also in the evenings. But if we could really speak to that, you're here. Does this work starting off, or, because I know sometimes when I'm calling because of a trouble or hear about something, it's usually in the evening. So I want to know 9 to 5, how long will we be at a 9 to 5? I know it's only 3 people, but how does that work?
Correct. We're going to start with 9 to 5, and that was under the advisement that we got from the contractor. So we're going to initially start with 9 to 5, and we'll see how things go. We looked at the different groups from the different communities that we've reached out to and talked to, and the vast majority did start with 9 to 5, and that is where they got their baseline, and then they advanced outward from there. And that's because the limited capability with the pilot group with the 3 counselors. And that's because of their span of control with only 3. And that's how they started. But definitely that will be the baseline, and we will branch out from there. And that's simply looking at the inherent data from the different groups. And we've reached out all the way from Houston to Denver, all the way across the country. And we looked at all that data, and that's how we came out with 9 to 5.
Good point. And thank you for that response, because I think it does have to be data-driven.
Yes, ma'am, my pleasure.
Thank you. Councilmember Patton?
Yeah, and Director Nutter, while you're here, I just want to put a fine point on the training for all ECC staff, right? Some calls will come in while these folks are not, it's not 9 to 5. And so all of the ECC staff are getting trained on how to route these calls, but then also handle them in an appropriate way outside of the hours of the CCD line.
That is correct. They're already trained on how to do that. What we're going to do is further enhance the training that they already have to make the transition to the CCD line much smoother. And our plan is, we not only have the counselors, but we also have the line that the counselors work from that we can also use as a backup. So it's going to ensure that there's a smooth continuity to ensure that our team knows when to use that line.
Gotcha. And how long do you think it'll take to have all your staff trained?
I think that because of our work schedule, I definitely think that it should only take 2 to 3 weeks for us to get our entire staff trained.
Okay. Thanks.
Any other questions? Okay, good work. Thank you.
My pleasure, ma'am.
Okay, the next item on the agenda is the 2025 Operating Capital Improvement Ordinance. Nick?
Good afternoon, Mayor and Council. As the Mayor said, you have in front of you the documents and the ordinances that are necessary for approving the FY25 operating and CIP budget. Wanted to throw a few other items in there. The Municipal Service District Budget Resolution is there as well as the Greater Raleigh Convention and Visitors Bureau Budget Resolution that you would annually approve with the adopted budget. Just a couple of things that was noted in the memo that's there. There have been some changes from the proposed manager's budget that you got back in May. Mainly around the 2 municipal service districts. So you've approved the expansion of the downtown municipal service district. So the general fund has increased by $634,000 and $635. And then you've had one reading for the creation of the Blue Ridge MSD, which is included in the budget ordinance. If you don't approve that, let's say that you approve the budget today, which you have plenty of time left here. If you approve the budget today but failed to act on that second reading of the Blue Ridge, there's a hinge there that automatically would come out of the operating budget, so we wouldn't have to revisit that. So that would add $472,530 for an additional general fund expense and revenue of $1.1 million that would be different from what you saw before. So any questions that you have about the ordinances, happy to answer those, or any other questions that you have about the budget.
I have a technical question about the Blue Ridge MSD.
Yes,
That's
ma'am.
on our agenda for the second reading on the 18th, correct?
Yes, ma'am.
So if we were to do something today, we don't have to vote on that until...
So you could vote on the budget today, and what we've done is we've worked with the city attorney's office, and that particular portion of the budget ordinance, which enacts the 3-cent tax rate, would go away if you failed to act on June 18th for the second reading of the Blue Ridge ordinance.
Okay, but that's separate.
Yes, ma'am.
Okay. Councilmember Harrison?
I don't know if this is the right time, but my understanding is there is a proposed tax rate for the existing MSDs as well in the budget. The downtown MSD has requested the revenue neutral tax rate, and then the Hillsborough MSD requested 15 cents, whereas 12 cents would be the revenue neutral tax rate. And so if council wants to change what is proposed, I assume we need to do that today or before we pass the budget.
Councilmember Harrison, both of those were included in the manager's proposed budget, so that's reflected in the ordinances that are here today.
Okay. So the 15 cents is, okay.
Yeah,
That was one of my questions, too.
Yeah, I do want to put it out there that we do have a significant tax increase overall, and so I have some concerns about raising by another 3 pennies, a particular area of town that is home to a lot of students. So I just want to put it out there for the Hillsborough MSD. I realize that they have some fixed costs that are increasing that I would like to support. And so, annual salary and healthcare increases, their clean and safe contract, general overhead, wage adjustments. But I think if we went to 13 cents, they could cover that. And then the other items that they've requested for the additional to get to 15. I'd like to hold off this year just because I want to, keep that tax rate manageable for folks in the area. So I'm going to put that out as a motion for the Hillsborough MSD to be a 13-cent tax rate.
What are the other services that would then be eliminated?
They do have some other ideas they wouldn't eliminate anything they're currently doing, but rather they wanted to perhaps grow their team, have new programs and services. They mentioned an engagement survey with residents, additional engagement activities like homecoming, working with the NC State Triangle alumni, more partnerships. So I think they'd still be able to add some items there. I know they had an idea for working with the Great Raleigh Cleanup, for example, the NC State Food Pantry, lots of great things here. But they would have to decide, how to prioritize.
Councilmember Branch?
Question, because I know one of the, within the ask, it takes their social worker, who I think is part-time to full-time.
That would be in their
would
fixed
that-
increased costs, and they could cover that with.
Yeah, that was my question. Would they be able to cover that?
Yes.
Okay.
Okay. So there's a motion on the floor. Councilmember Harrison? Is that a motion?
That's a
Okay.
motion.
Yes. Okay. All in favor? Okay. That was unanimous. Thank you. Okay. Do we have a motion on the budget? Councilmember Jones?
All right, thank you so much. I have a few questions. I'd like to start in transit. With the R line, I had some conversations, and I'd just like some clarity. Would the R line in this budget continue to be free, or would this now also move to being fares instated?
Councilmember Jones, I'm going to ask David Eatman from the Transit Department to answer that.
Thank you.
Good afternoon, David Eatman, Transportation. So during our presentation at the last council meeting, I did present the Raleigh Transit Authority did vote to return fares, or actually return fares, but to begin fares on the R line. So the R line obviously was created originally with the convention center, providing downtown circulation so that individuals had access to entertainment venues and restaurants. At that time, there was a decision not to charge a fare, but again, that is the Raleigh Transit Authority's recommendation. And so certainly, traditionally, fares are set by council and recommendations are made by the Transit Authority. So transit staff would be looking for some guidance on that, but again, the Transit Authority is in favor of that.
So right now, as it is, unless council makes a motion to in-state fares on the R line, it would go through as fare-free for R line.
That is correct.
Okay. I think I have some, I just want to have some discussion on that here, because I don't know that that feels equitable, that one area of town gets fare-free when the rest of the routes are charged. So I just wanted to open that up.
I'm very comfortable, for my mayor.
Yes.
I'm very comfortable with us adding fares to the R line. I think one of the big things we talked about in the beginning with so many new services, as we get back to our targeted new peak service of 15 minutes and 30 minutes and BRT, we may be coming back and phasing it out again, because that's why we phased it out the first time. So I think adding fares with the new route that it now has anyway to take people to certain areas, I think it is fair. And David and I, we had already talked about ways to work with the convention center. Yes, adding fares. Adding fares. We've never had fares on the R line until.
Never.
So we're talking about adding fares to the R line. So I think in adding fares to the R line now, we talked about working with the convention center and things for events. There's ways and services that they can purchase passes for those residents, for those individuals visiting that may want to use it. So I'm comfortable with us adding fares to the R line.
The last meeting we had, I asked what ridership numbers look like, because what I'm seeing are just empty bus after empty bus after empty bus. Quite frankly, I'm concerned just about even providing this service. and I'm concerned about the way it was brought forward. So do we have any ridership numbers to share right now?
Right now, we're only at about 10% of pre-COVID levels on the service. It has been out for about 30 days. Normally, we would want probably about 6 months minimum just to see what, ridership will happen. We have just begun to market the service. So again, with no marketing on the street for about a month, at about 10% of pre-COVID levels. So again, that is much lower than we would want, most definitely. Pre-COVID, right before COVID hit, we were probably about 60 to 70% of our system's average ridership. So, it was an upper performer even pre-COVID when it was actually lower than it was in its early days when it was created. Certainly, the downtown, what was the R line, we kept the name, completely different service than what people can traditionally think of as the very circular route. Now it's more of a linear route, but certainly we'll provide that update. I know that there was also a request for a little more comprehensive information on some other things as well. So certainly we'll add that to that update as well.
Okay, thank you. Was that a motion that you made, Councilmember Jones, to instate fares on the R line?
It is now, yes. I think that we should definitely reinstate fares on the R line pending that ridership, because I think that was a really good question, but I guess we can come back with more information as we go along, and we're monitoring the ridership to see if we need to continue that. But yes, I'd like to make the motion to reinstate fares on the R line moving into this next year's budget.
Second.
It wouldn't be reinstate fares.
It's adding fares.
I'm
It
sorry,
would be
that's
add
right.
fares.
My
'Cause
apologies.
this, so just adding fares, I just want to make sure we have the correct language in
No, I
the
appreciate that. I'm so sorry.
motion.
I meant I would like to add fares to the R line in this upcoming budget.
Second.
All in favor? Aye. Opposed? Councilmember Black opposed.
And then I have a few more questions. The second recommendation that came from the RTA had to do with the paratransit getting the same benefits, including those who use Medicare. And can you explain that? I don't know that I followed that second recommendation coming out of RTA.
Okay, so let me start with the June 4th presentation. So we presented the access fare at $250, which is twice the base fare. So that is what's currently in the budget. It is my understanding, or at least the only correspondence that we received directly from the Transit Authority at our meetings was they did vote to recommend a 50% of the $250. So 50% of the pre-COVID fare. So it would bring the paratransit fare down to $1.25, just like our regular fixed route fare. Obviously, the cost per trip between those two services is very different. One is a curb to curb and actually a door to door upon request service, and the other one's a fixed route bus. So really apples and oranges as far as the provision of service. I think some other conversations was out there is we do follow federal guidelines as it relates to Medicaid transportation, or I'm sorry, Medicare transportation. So anyone with a Medicare, a red, white, and blue Medicare card can have that card and receive a half fare ID from us or a half fare pass. That is federal law for fixed route. Does not apply to paratransit at the federal level, but I think that was the reference that is probably out there. I am on assumption on that because I haven't talked to a board member directly about that, but that sounds like what they're talking about if they're talking about Medicare.
Okay. I don't know that I understand enough to make any motions on that, but I appreciate the clarification.
Can I just follow up on that? So that, is it a policy choice that the Medicare provisions are not accommodated for paratransit?
That is correct.
This is a policy choice by the city?
That is correct.
Okay. And what would be needed to, we would just make a motion here at the table to
That is correct.
change the policy?
Yeah.
Okay.
So right now, the paratransit budget is set, and so any change to that would impact those numbers. And so we would have to cut transit would be, we would have to find that within our budget. And obviously, if we are a fairly lean organization. Most of our dollars go directly into service on the street. So if we get too deep, we actually cut service.
Got
Just at current budgeted levels.
Okay, so so for fixed route, Medicare is reimbursing that other half of the.
No, it's just a federal law. Everyone that receives federal funds nationally, if someone has Medicare, can ride transit half fare. It's a federal law.
Unfunded
That is
mandate.
correct.
Got it. Understood. Okay, well, that might need some more deliberation then.
So a few other questions I had. The 8 cents per transaction fee, which is budgeted at 150,000 in there, when I kind of just loosely did the math in my mind, that kind of translated to about 650,000 rides. And I just wanted to speak to how many rides are you anticipating? It feels like it's a little low for that transaction fee, but I know that we've talked and there are many different avenues, so if you can explain that.
Yeah, so that gets a little bit in the weeds and complicated, but if you take 150,000, I think at 8 cent is 1.8 mil. So we're at like 1.875 mil. And we actually have a tiered structure. So it starts at 8 cent, and the more riders you get, it drops from 8 to 4 all the way to 1 cent per ride transaction fee. But that 1 cent probably we wouldn't be qualified, we would not qualify for that rate until late in the fiscal year. So we did some projections with reasonable projections on ridership throughout the year. And so we came up with the 150, but that 150 is spread across mostly the 8 cent per trip, partially the 4 cent, and just a few maybe at a penny, because that benchmark is so high, it would be very difficult for us to reach that. But hopefully that wasn't too confusing there. But again, we're looking at a utilization rate of about 1.8 million to about 3.7 million with that range of 8 cent to 1 cent. And again, our ridership, we're projecting about 5 million in FY25. So, pretty good utilization is what we're looking at.
Right. And so when we spoke earlier, there's also not everyone's going to use the app. And that
is
was
correct.
also part of it.
All of our pre-COVID fare options are available. Okay. All of our day passes, monthly passes, those are swipe passes. We also have our debit contactless smart card as well, which will be for sale. So we have all of those options, as well as our UMO app, which will be available on your cell phone. And we'll also have the UMO Go Pass for our low-income or transit assistance program.
And then I just want to tie in to our previous conversation about paratransit. I know that it was attached to the fixed routes, and now in Briar Creek, we've just brought that route back up to hourly.
So it was a split service or a peak service. It actually started with what we called a reverse commute grant from Federal Transit Administration to allow employees to get to jobs in the suburban retail sector. So it stayed that service, which did not carry ADA for many years. Just May 5th, that service went from hourly service 6 a.m. to midnight. So that would have paratransit, or does have paratransit coverage now from 6 a.m. to midnight, as well as fixed route coverage from 6 a.m. to midnight.
Okay, so just clarifying, because in my district, selfishly, I just want to make sure that paratransit is available for all as well. And we just made that transition back to the fixed route earlier this month, so that's something that may not be reflected in what was previously allowed or available, but now there is paratransit in District E.
That is correct.
Creek. Okay.
All the way to midnight.
All the way to midnight. Okay, great. I think for transportation that, I have a few other questions, but for transportation, I'm done in case somebody else has anything else.
You now get a break, David.
Thank you so much. The next question I have, I think, is how many employees are affected in the terms of raises who fall under the maintenance specialist and supervisor roles that are eligible for that 6 or 9%?
I don't have those numbers in front of me. We could get those back to you, but we don't have those numbers.
We don't have those numbers. Does that cross the departments, everyone with the term, with the maintenance specialist or supervisor, or whatever, everyone across the organization would be eligible for that raise?
That's correct. So I think it's in Parks, Recreation, Cultural Resources, Raleigh Waters, Solid Waste Services, RCC, the Raleigh Convention Center. So there are several departments that have positions that are reflected in those particular positions.
Okay, because we have the number, so we know the number, we just don't have that right now.
I just don't have that in
You just
front of
don't
me.
have it in front of
no.
you. Okay, And then overall, as I was looking, thank you guys all for answering all of our questions in email format. Really, really appreciate that. In there, we talked about vacancy rates, and there was a difference from what we'd seen prior. It's been reported in the financial outlooks in both, I think, the quarterly ones that we had in January and then in March, that our vacancy rate was 15.4%. But in that response that I received, that we all received back, that went down to 12.8%. So I'm just wondering how that happened. Did we hire that many people? How did we go down from 15.4 to 12.8?
So as you can imagine, council member, recruitment and retention is constantly in flux. The number that you saw in the quarterly financial report was as of March 30th. So since then, we've made concerted efforts in an organization to hire people, recruit folks. So that number, obviously, given that we've, I'm sure that there has been attrition within the organization as well, but we've also done a concerted effort to be pretty robust in our recruitment efforts. So we've obviously hired folks as well, which is why that vacancy rate has gone down.
Okay.
Yes. So the number that you received was a number in real time based on, when we sent the information as of last week. So that was the most current information from the HR department.
In the last update that you guys gave, you had two numbers. So previously I've seen the 15.4%, and now we had two numbers on that chart. Can you help me understand the difference between those two numbers?
Yes, absolutely. So what we wanted to clarify also is that, with COVID, and this is just not a Raleigh problem, this is a Wake County and nationwide issue, whereas we've just had concerted effort in filling certain number of positions. So when you kind of remove those positions, because we realize as an organization, which is why we're doing the class and comp study, that we do have to be a little bit more competitive in the rates that we offer for those particular positions in the city. So if you remove those positions, the vacancy rate actually goes down a little bit, which is why we just wanted to be transparent and be upfront about the fact that we are having some issues filling certain positions, which is why we're doing a class and comp study. And then, of course, if you look at the organization as a whole, including those positions, that vacancy rate does creep up a little bit.
Okay, I'm going to repeat that back and maybe point out where I'm misunderstanding. Are you saying that there are some vacancy positions that we removed from the budget? And that's
we
how
have not
that
removed
lowered?
anything from
Oh,
the
okay.
budget. I want to be really clear
Okay.
because we have received questions from City Council about positions. We have actually added 55.6 FTE as an organization. So we haven't deleted, any positions. We did make, as the manager said in her budget, we did kind of go back and, if we could delete some positions that have been vacant for a while, and that department has said we don't need any more, then yes, of course, we got away with those, But as a whole, this organization, as part of the fiscal year 25 budget, has added 55.6 FTE.
Okay. All right. Thank you so much. I do want to highlight, just for staff, I really appreciate you guys working with us and answering these questions. I promise that this does not mean that any of us don't like you. If anyone ever says that to you, promise you they're gaslighting you, because we love you and we respect all of the work that you do. So it's really just questions that I'm hearing in the community that I just want to make sure that I'm able to clearly answer. So I really do appreciate the work that you do and everything that went into this budget. So thank you very,
We
very much.
appreciate that. Thank you very much.
Okay, any other questions? Okay, Councilmember Harrison?
Yeah, this is, I guess, a request for a manager's update, Marshall, and it's about how do we think about tax rate increases over time and whether we have any benchmarks for trying to hold our rate at a certain level for, affordability and costs. I did look through what other communities are going to be raising, their tax rates in Wake County, and from what I can tell, we are raising it the least.
We are.
And so I just want to put that out there. I know this is going to be a higher bill for some folks, but some other communities, they are even doubling it, like that much more than us. So I know you all have done your best to keep it, as low as you can, while also increasing the services that we all badly need and paying for our essential employees and making sure that they have the wages that they need. But I would like to see if there is some way that you all think about that into the future. How do we ensure that our tax rates over time are sustainable? So just trying to better understand how you think through that. Thank you.
We can do that for sure, yes.
Okay, Councilmember Branch and then Patton.
Just on top of that, I think, and maybe I missed it in the manager's update, I had made a request for how we've increased the tax rate since the last adjustment. If that can just be resent out, I think it'll be helpful. It goes to your point. But the point was, yes, we reduced the rate here, but this bond caused the increase, or these salaries or our positions caused the increases. I think having that data of the why will also help address your concern. And then I was ready for a motion at the appropriate time.
Okay, Councilmember Patton.
Yeah, I just, while we're talking about it, just wanted to lift up, I know at the retreat, there was mention of, I think it's called steady state. Is that the term of art for it? And I know that that takes a lot of internal work, but I do think that's a gift to our taxpayers, ultimately, our residents, to get to, for those viewing at home, it's when you like build in extra capacity in your budget so you don't raise taxes every single year, and so it just provides a lot of predictability. And so I do just kind of want to put a star on the work I know y'all are already doing, and I'll look forward to seeing how we can move in that direction.
Yes, we've started preliminary plans to kick it off for FY26 and kind of figure out some level of predictability moving forward of how we enter into debt and how we make financial decisions. And we're geared up and ready to go.
Madam Mayor, I have Councilmember Jones's answer to the question.
Nick.
So it's 85 specialists and 10 employees currently as crew supervisors. Those are the filled positions. So there are many.
85 and 10, so 95 positions across the entire organization will be affected by those 6 and 9% raises.
That is correct.
With maintenance.
That does not include the vacant positions. So there are of course vacant positions
That are eligible for that.
but these are the ones that are eligible, or those vacant positions. Those positions would be moved. The minimum would be moved up. These are the positions that would be eligible for the increase, assuming that they're that are eligible for the increase. Right.
When they're filled, they'll be at that new higher 6 or 9% rate. Yeah.
And just to follow up on that, the police and fire and ECC who are eligible for the up to 10% raise, I'm throwing numbers at you again, and you may not get it, but does that cover the entirety of our public safety staff? Or does that not affect, does that touch every member that sits in fire, police, and ECC?
So that
Up to
go ahead, Major.
broadband.
That's right.
It's up to broadband, and the
What does that
broadband
mean?
of
I'm so
those in
sorry.
the executive. So those that are in the command structure fall within the normal performance evaluation cycle. So up to captains in fire, up to sergeants in police. And then both chiefs will have the flexibility with their merit pools to work within the 1 to 6% pay range to make those additional for their executive employees.
So the executive employees are not included in that 10%. That is going to be based on the chief and captain's decision, and they get that 1 to 6%, not eligible for that 10%. Okay, cool. I don't know the breakdown of that, so I can't in my mind see that. But okay, thank you. I
It would
appreciate
have
it.
taken us to another penny of a tax increase or close to it to kind of encompass all of that. And when we looked at our peer market benchmarking, we were doing really well in the management positions. And so we'll let the comp study kind of guide and direct what those increases should look like moving forward. But in the two presentations from HR, they work with budget on the general employees below broadband.
Okay, thank you.
Also, I wanted to highlight on top of that 6 and 9%. I think based upon their merit, they could get another 5%.
Yes.
On top of that.
That's right.
So
Yes.
that would be 11 and
Could be 15 for some. Yeah.
for some.
Wow.
Okay.
Or 14,
So-
yeah.
Okay. Any other questions? Okay, Councilmember Branch, you,
Yeah, I think, as a council, we've done a lot of work in trying to move things forward. But I think this budget probably accomplishes a lot, but there's still, as we had our conversations today, more work to be done. And I think because we're working on that, we have a plan, we have a roadmap to work on things as far as our Raleigh Hearts program and co-response going out, not co-response, but alternate response. But also as we look at our housing needs and challenges that we're facing as a city. But most importantly, the one thing that I've always noticed sitting here, the most important people are usually the ones out in their chairs looking back out at us or watching us on TV, and that's our staff. And this year, we are having some increases for our staff, and I look forward to our comp study in which we can do more in the going future. But I think this budget is a reflection of us trying to say thank you. And at the same time, we know we need more to do, but we need more of you. And we need to get you some help and staff some positions so that you can do the things that are needed. And with that said, and I could say a lot more, but I don't think y'all want to hear me talk forever, I move to adopt the ordinance necessary to enact the fiscal year 2024-2025 City of Raleigh operation and capital budgets.
Do we have to spell out the operating budget, the capital project ordinance, municipal services, and Greater Raleigh Convention and Visitors Bureau?
Just adopt the ordinances as presented in the
Okay.
agenda.
Yeah.
All right. Then,
With the amendment that you all made.
With
to the-
with
to the
amendments made for
first
today.
read. That's correct.
yep. What he said. Do we have a second? All in favor? Aye. Opposed? Okay, budget is approved 5-2 with Councilmember Jones and Black in opposition.
Madam Mayor, do you excuse absence for Councilman?
Oh, yes, Councilmember, Mayor Pro Tem is excused and absent. I just want to thank the staff, City Manager's Office, all of you for the tremendous amount of work that has gone into this. I mean, we started this process in February, and there was a lot of feedback, a lot of attention.
We started in October.
In October, but really with intention when it started becoming more public.
Real,
And when it became real, that was in February. So we've been talking about this for a long time, and you'll start working on next year's budget in October again. So, yes, something to look forward to. But I just want to say thank you to everybody for all the hard work that went into this and all the thought. You were great listeners. You heard what was important to people, and you're making it happen. So I just want to say thank you.
And Mayor Baldwin, we know this is your last budget with us, so we also wanted to say thank you to you for your leadership. We
Thank you.
appreciate it.
Yeah, 15 budgets. Yeah, I'm good now. Thank you. Thank you very much.
Thank
Okay.
you so much.
Councilmember Patton?
Yes.
Is that a hand raise?
Yes.
Okay.
I didn't want to inject before the vote was called. It gets a little thrashy sometimes, but if you'll indulge me, I always like to pull things out of consent, and this is the same. I really, what I love about local government is this sort of like, we worry so you don't have to approach, and there are a lot of things that didn't make it into the budget that I know our community would have liked to see. It's not perfect, it never will be, but we're always iterating. But there are a lot of good things, and I just wanted to make sure we didn't miss naming them. There's a lot of future planning in this budget, the penny for the pay study, so that we're building capacity to raise the wages as soon as the study is complete, and we don't lose like years and years of budget, and then the study is already outdated before we can implement it. The penny for pay-go, so that we can do things like replace HVACs and roofs on our buildings. The apparatus replacement fund. Those are all like really important investments in Raleigh's future that we're making. Also, no increases to premiums for employee health insurance, significant raises for our first responders, another ladder truck, positions for the civilian crash unit, $5 per person in the city for arts, painting the fire hydrants so that they're more visible at night. I didn't even know that was a thing until I read it in this budget, but I'm glad that we're doing it. I'm glad that you all know that's a thing. And $2.5 million invested in the Upper News Clean Water Initiative. anticipated that the work of our stormwater department will lower our flood risk score. It's like golf, the lower the better, which has positive benefits for our residents on their insurance rates, small business legal and accounting workshops. Wins that are directly from my district are things like the Upper Durant Lake project, equipment. I hear about mulching the medians, probably one of my top 5 constituent concerns. And so we're getting new equipment for mulching the medians. We're adding a fire marshal position to aid in oversight of blasting activities. Last year we got a new pool shell replaced at Buffalo Road Aquatic Center, and there's a water main expansion at Perry Creek and Durant. So this is a long book, but like buried in it are these millions of nuggets of good work that's being done all across our city to take care of our residents. So those are, I'm sure I missed some, but I just want to take a minute to highlight them. So thanks.
Okay, with that, I will now adjourn our budget hearing, and we will see you all here tomorrow for our work session at 4, and then public comment at 7. Thank you.